Fungal ear infection otomycosis. Your ear starts to itch. Then you feel discomfort, even pain. Sometimes there's discharge or a strange smell. This could be a fungal ear infection, medically known as otomycosis. Otomycosis is a fungal infection of the outer ear canal. It's also called Fungal Otitis Externa. The condition is most often caused by two types of fungi: Aspergillus niger and Candida. Among these, Aspergillus niger causes the majority of cases. These fungi are commonly present in the environment and usually don't cause harm. They usually become a problem only when the ear's natural defense mechanisms are disturbed. This can happen if the skin of the ear canal gets scratched, especially when it is wet at the time. Wet skin is more fragile than dry skin. So, scratches on wet skin tend to be deeper. A fungal infection of the ear can also occur after using certain home remedies, which are unfortunately quite common and create a favorable environment for fungal growth. Why it happens? Using earbuds to clean wet ears is one of the biggest causes of fungal ear infections. When your ears are wet, after swimming or showering, the skin inside becomes soft and fragile. If you poke it with an earbud or any object, it can easily tear. These small cuts go deeper on wet skin than on dry skin, and that's where infection starts. In dry or non-humid areas, these infections are usually bacterial. But in humid areas, where moisture lingers, they're mostly fungal. Sometimes the infection can be both fungal and bacterial, making the treatment a little tricky. Symptoms. Otomycosis often begins with severe itching. Then there's pain, which may worsen over time. You might feel a blockage or fullness in the ear, experience muffled hearing, or notice some discharge. In some cases, the infection can also produce a mild odor. Diagnosis and treatment. When you visit an ENT specialist, he will examine the ear using an otoscope or diagnostic endoscope. The infection is usually easy to identify by looking at the ear canal. Treatment starts with cleaning. The doctor carefully removes fungal debris and discharge. Once the ear is clear, antifungal ear drops are prescribed to eliminate the infection completely. Treatment usually lasts for 1 to 3 weeks, depending on the severity. Most people feel relief soon after cleaning. But it's important to complete the full course of medication. Home remedies: what to avoid. Severe itching is the hallmark sign of a fungal ear infection. But many people mistake it for dryness in the ears, especially in the early stages. The itching from otomycosis is quite distinctive. It's deep, persistent, and often gets worse when you try to scratch or clean the ear. Believing it's just dryness, people tend to use oils, ointments, or antibiotic ear drops at home. But this only makes things worse. Oils act as food for the fungus, helping it grow, while the antibiotic drops, when used without any bacterial infection, kill the bacteria in the ear canal that are naturally present, but generally don't cause any infection. Once these bacteria are gone, fungi can spread rapidly. In fact, such home remedies can worsen the infection overnight or even trigger a new one, especially in fungal or mixed ear infections involving both bacteria and fungi. Safe home care tips. Try to keep your ears dry at all times. If water gets into your ear while swimming or bathing, just let it air dry naturally, don't rush to clean it. Avoid using cotton buds, hairpins, or any kind of instrument inside your ear, as they can easily cause tiny cuts or push debris deeper. If cleaning is really needed, it's best to leave that job to an ENT specialist who can do it safely. Complications. Otomycosis complications usually develop when the infection is left untreated, or when home remedies are used, which can aggravate the condition. Although a fungal ear infection does not spread beyond the ear canal, it can still cause perforation of the eardrum. This perforation, if ignored, can turn into a permanent hole. And once that happens, surgery is often needed to restore the eardrum. Interestingly, perforations caused by otomycosis are more likely to become permanent than those caused by other conditions. while the fungus itself doesn't spread from the ear canal into the middle ear. The perforation exposes the middle ear to the outside environment. This exposure can lead to secondary infections and other complications inside the middle ear as well. The bottom line: fungal ear infections are uncomfortable, but completely treatable. Early diagnosis, proper cleaning, and antifungal therapy can help you recover quickly and prevent complications. Take care of your ears, avoid cleaning them yourself, keep them dry, and protect them from infection. Healthy ears mean better hearing and greater comfort every day. To know more, please read our article, Fungal Ear Infection, Otomycosis. Link in the description. Stay healthy. Stay happy.